One of the most frequently asked questions we get in our private Facebook group for Medicare beneficiaries is, does Medicare cover the shingles vaccine? Many people believe that Medicare doesn't cover the shingles vaccine because they usually pay quite a bit for this vaccine, whereas they pay nothing for it if they receive the vaccine while they're still in their employer coverage. The good news is that the shingles vaccine is covered, it's just not covered under original Medicare Parts A or B. Instead, your Medicare Part D drug plan is required to provide coverage for the shingles vaccines. Hi there, I'm Danielle Kunkel-Roberts, co-founder here at Boomer Benefits and best-selling author of 10 Costly Medicare Mistakes You Can't Afford to Make. It's a good thing that Part D covers shingles vaccines because there are an estimated 1 million new cases of shingles each year in the United States. The risk of an outbreak increases with age, so people over age 65 are more susceptible than younger adults. For this reason, many doctors encourage people on Medicare to go ahead and get vaccinated. The recommended age for the shingles vaccine is 50 or older. All Medicare Part D drug plans cover the Shingrix vaccine, and Medicare Advantage plans with built-in Part D coverage will also cover Shingrix. However, since Part D plans have networks, you'll want to be sure to get the vaccine at a pharmacy in the plan's network. Do not get the shingles vaccine at your doctor's office. Get the shingles vaccine at the pharmacy where they are used to billing the Part D drug companies. You see, doctors' offices don't have the ability to bill Part D plans. Therefore, getting the vaccine at your doctor's office could result in you paying the entire bill up front and then having to submit a reimbursement request to your Part D drug plan. The confusing part about that is that Medicare Part B does pay for some of the other vaccines like flu shots and pneumonia. However, with the shingles vaccine, they went a different route and they made it available only under your Part D drug plan. Now you can find both the Zostavax and Shingrix versions of the vaccine on your Part D plan formulary. Check your Part D drug formulary ahead of time to see which tier the vaccine falls into. Many plans put the vaccine into a Tier 3 category. According to GoodRx, Shingrix retails for around $155 per shot at the time this video is being recorded, but you'll need 2 rounds of the shot when getting this shingles vaccine. If you get the Shingrix vaccine before starting Medicare, your employer health plan will likely cover the entire cost of it. However, if you receive your vaccine while on Medicare, it will likely cost more, especially if you get the vaccine before you have met your Part D plan deductible for the year. Some Part D drug plans have deductibles as high as $445, so if you're still in your deductible period, you will likely spend around $150 to $200 for the vaccine. If you get your vaccine after you've met your deductible, you'll simply pay a copay or coinsurance for the shot according to the tiered pricing schedule inside your Part D plan. Because some people get their shingles vaccine early in the year before they've met their plan's deductible, they end up thinking the vaccine was not covered at all, and this is why so many people think that it's just not covered. But in reality, the vaccine is covered and you are getting a small insurance discount. It's just that you have a deductible to meet on your plan and the vaccine is being applied against that. You can compare costs by checking the pricing on GoodRx.com, where you can find coupons that may save you some money on this vaccine. However, the money you pay for your shingles vaccine when using a GoodRx coupon does not go toward your Part D deductible. Here's a quick reminder about a billing issue that our client service team commonly resolves for our policyholders. Some people don't know to get the vaccine at their pharmacy, so they get it instead through their doctor's office. And unfortunately, many doctors continue to bill this to Medicare Part B instead of Part D, which results in the bill getting rejected by Medicare. Then the doctor sends the patient a bill for the cost of the vaccine. Far too many Medicare beneficiaries just pay these bills without ever questioning them. One client remembered that our client service team provides free help resolving bills like these and called us for support. Her doctor's office had tried to bill her $710 for this medication, which is ridiculous. The shingles vaccine costs between $150 and $200. And if your Part D plan is covering part of the cost, even less. We helped her negotiate a bill for the valid price. So if your policies are through our agency, please don't pay any medical bills that you receive without checking with us first. We might just save you some money. Do you have questions about Medicare and vaccine coverage? Leave them in the comments below. I also recommend watching our How Medicare Part D Works video here on YouTube. Thanks for watching, and we'll see you in the next video.